Some of these are common sense. Some may surprise you, but all of them matter because they can either make side effects worse or completely derail your weight loss progress.
Here's a number that should concern anyone on Ozempic or anyone thinking about starting it. According to clinical research, up to 40% of the weight lost on GLP-1 medications can come from muscle instead of fat. Not because the medication doesn't work, it works incredibly well, but because people unknowingly sabotage their own results with mistakes that seem harmless, or worse, mistakes that actually sound healthy. The frustrating part? Many of these errors get actively promoted online. Eat less, push through the nausea, skip the gym because the medication does the heavy lifting. Wrong! This video breaks down the 11 things anyone on Ozempic, Wegovy, Zepbound or Mounjaro must never do if they want real lasting results. Number 10 rarely gets discussed, but it causes that the medication just stopped working complain more than almost anything else. Let's dive in. Number 11. Never crash diet because appetite is low. This is the number one self-sabotage pattern, and it makes logical sense on the surface. Appetite drops dramatically on Ozempic. Food noise disappears, so the thinking goes, perfect, eating almost nothing will melt the fat away even faster. Here's what actually happens. The body interprets severe calorie restriction as a threat. After just 5 days of extreme restriction, metabolism slows and key organs become less efficient. Worse, even with adequate protein, eating too few total calories forces the body to break down muscle for energy. Research on metabolic adaptation shows that GLP-1 medications already extend the weight loss window before plateau, typically around 60 weeks of continuous use. Trying to speed things up through starvation diets produces the opposite effect. The body adapts exactly as biology predicts it would. Clinical guidance recommends consuming at least 60 to 75% of maintenance calories spaced every 2 to 3 hours. The goal isn't eating as less as possible. The goal is fat loss while preserving muscle. Small meals are fine. Starvation is not. Number 10. Never let protein become optional. This mistake deserves its own category because the research here is striking. The Step 1 trial's body composition analysis found that lean body mass decreased by nearly 10% among semaglutide users. In some analyses, lean mass made up roughly 40% of total weight loss. That's not fat loss, that's muscle loss. And muscle loss means slower metabolism, weakness, and that dreaded skinny fat appearance people complain about. A joint advisory from 4 major medical organizations, the Obesity Medicine Association, American College of Lifestyle Medicine, American Society for Nutrition, and the Obesity Society now recommends protein intake of 1.2 to 1.6 grams per kilogram of body weight daily during GLP-1 treatment. For someone weighing 154 pounds, that translates to roughly 84 to 112 grams of protein every single day. Per meal targets of 25 to 40 grams optimize muscle protein synthesis. Research shows no additional benefit above 40 grams per sitting, so spreading intake across meals matters. When appetite is low, make protein easy. Greek yogurt, eggs, cottage cheese, chicken, tuna, or a simple protein shake at the end of the day if needed. Protein first, every time. Number 9. Never skip resistance training. Here's a fact that changes the conversation. Clinical evidence demonstrates that resistance training reduces lean body mass loss by 50 to 95% during weight loss. That's not a small improvement. That's the difference between looking toned versus looking deflated. A Copenhagen randomized controlled trial published in the New England Journal of Medicine found something remarkable. Combining exercise with GLP-1 therapy achieved 16% total weight loss compared to about 10% with diet management alone. Even more telling, 1 year after stopping treatment, weight regain was 6 kilograms larger in those who used medication alone versus those who exercised. A case series from Texas Tech University documented what happens when patients actually combine GLP-1 therapy with structured resistance training. One patient lost 33% of body weight with only 6.9% lean tissue loss. Another lost nearly 27% while actually gaining 2.5% lean tissue. A third lost over 13% while gaining nearly 6% lean tissue. The recommendation from researchers: resistance training 3 to 5 days per week, targeting all major muscle groups. Not extreme, not hours in the gym. 20 to 30 minutes, 2 to 4 days per week makes a measurable difference. Number 8. Never get dehydrated. This one catches people off guard because it happens gradually. Research published in the American Journal of Physiology revealed something most patients don't know. GLP-1 medications actually suppress thirst signals independent of the side effects on food intake. It's called the hyperdipsic effect. So, appetite drops, thirst drops too, and people drink less without realizing it. Meanwhile, the medication's gastrointestinal side effects, nausea, vomiting, diarrhea, cause direct fluid loss. The FDA warning label notes that acute kidney injury has been reported in patients experiencing dehydration from GI symptoms. The UK's MHRA has issued warnings about severe dehydration requiring hospitalization in GLP-1 users. Evidence-based targets suggest 2 to 3 liters of total daily fluid. That's 91 to 125 ounces. An easier calculation, half of body weight in ounces. Someone weighing 200 pounds would aim for 100 ounces daily. The critical point? Feeling thirsty cannot be trusted on these medications. Establish a regular drinking schedule and monitor urine color. Pale yellow indicates adequate hydration. Dark yellow means drink more immediately. Number 7. Never eat like nothing changed. Ozempic slows gastric emptying. That's part of how it works. But here's what that means in practice. High-fat, high-sugar meals sit in the stomach significantly longer than before. That's when severe nausea, reflux, bloating, and vomiting hit. People blame the medication, but often the real issue is feeding a new physiology like it's the old one. According to Cleveland Clinic guidance, foods to minimize include fried foods, pizza, cheeseburgers, chips, pastries, sugary drinks, and heavily spiced dishes. They don't mix well with delayed stomach emptying. The fix isn't complicated. Build meals around lean protein first, then fiber, then moderate portions of healthy fat. Fats aren't forbidden. Portion size just matters more now. Most GI side effects occur during dose escalation and typically improve substantially by week 20 of treatment. Eating smaller, more frequent meals, 5 to 6 mini meals instead of 3 large ones, helps the body adjust faster. Number 6. Never drink calories mindlessly. There's a caveat here. Protein shakes can be valuable for hitting protein targets, but certain liquid calories deserve scrutiny. Alcohol, sugary coffee drinks, juice, and smoothies that are basically dessert in liquid form all bypass the satiety signals that make GLP-1 medications effective. They slide right past the delayed stomach emptying that normally helps people feel full. Alcohol specifically creates multiple problems. It worsens sleep quality, increases cravings, intensifies reflux on an already sensitive stomach, and has a diuretic effect that compounds dehydration risk. Both alcohol and GLP-1 medications can lower blood sugar, and combined effects may cause unpredictable swings, especially concerning for people with type 2 diabetes. The boring truth? Water, sparkling water, unsweetened tea, and simple coffee should make up the majority of daily fluids. Interestingly, some patients report naturally reduced alcohol cravings on GLP-1 medications. A 2024 study showed a link between GLP-1 use and reduced alcohol consumption in people with alcohol use disorder. Number 5. Never use the scale as the only measure. Daily weight fluctuates from water retention, sodium intake, stress hormones, constipation, and even inflammation after strength training. People see the number jump after a workout and panic. Then they overcorrect, skipping meals, abandoning exercise, and create actual problems. Here's the reality check. A real plateau is weeks, not days. Daily fluctuations of 2 to 5 pounds are completely normal and mean nothing about fat loss progress. Better data points include weight measurements taken at the same time each week, how clothes fit compared to a month ago, progress photos taken monthly under the same lighting conditions, and weekly weight averages rather than daily numbers. The scale matters, but it's one data point among several. Obsessing over daily changes leads to exactly the kind of erratic behavior: crash dieting, skipping workouts, inconsistent dosing that actually stalls results. Number 4. Never freestyle dosing. The FDA-approved titration schedule exists for a reason. Starting dose is 0.25 milligrams weekly for weeks 1 through 4. This dose is for tolerability only, not therapeutic benefit. Then 0.5 milligrams for weeks 5 through 8. Then 1 milligram for week 9 onward, with a maximum dose of 2 milligrams if needed. Each increase should occur after at least 4 weeks of the current dose. Rushing this process doesn't speed up results, it speeds up side effects. For missed doses, FDA guidance is specific. If within 5 days of the scheduled dose, take it as soon as possible. If more than 5 days have passed, skip. the missed dose and resume the regular schedule. Never take 2 doses within 48 hours of each other. Here's a sobering statistic. Utah Poison Control Center reports a 640% increase in poison control calls about GLP-1 medication since 2020. Approximately 20% required medical evaluation. Many involved dosing errors or compounded formulas with inconsistent concentrations. Consistency matters. Follow the schedule. Don't chase the scale with dose changes without consulting a healthcare provider. Number 3, never inject the same spot every time. Almost nobody discusses this, but repeated injections at the same exact location cause lipohypertrophy, fatty lumps or nodules under the skin that impair medication absorption. The result? Unpredictable drug levels. Some weeks the medication seems to work great, other weeks barely at all. A case report in medical literature described a 75-year-old patient who developed quarter-sized, hard, raised nodules after repeatedly injecting semaglutide in the same spot. Research suggests up to 2/3 of patients requiring repeated injections may develop lipohypertrophy at some point. FDA prescribing information specifies 3 approved sites: the abdomen at least 2 inches from the belly button, the front or outer thigh, and the back of the upper arm. The guidance explicitly states to use a different injection site each week when injecting in the same body region, spacing injections at least 1 inch apart. Never inject into injured, swollen, or scarred skin. Rotate sites consistently for reliable absorption. Number 2, never ignore red flag symptoms. Most side effects are manageable and improve with time, but certain symptoms require immediate medical attention. The FDA boxed warning, that the highest warning level, addresses thyroid concerns. Semaglutide caused thyroid tumors in rodent studies. While it's unknown whether this translates to humans, anyone experiencing lumps or swelling in the neck, hoarseness, trouble swallowing, or unexplained shortness of breath should contact their healthcare provider immediately. Stop the medication and seek emergency care for signs of pancreatitis, severe abdominal pain that won't go away, especially pain radiating to the back with or without vomiting. Signs of severe allergic reaction, swelling of face, lips, tongue, or throat, difficulty breathing, severe rash, rapid heartbeat, or fainting require calling emergency services immediately. A 2023 FDA update added warnings about ileus, which is intestinal paralysis, persistent severe bloating, complete inability to pass stool, or severe stomach cramps that won't stop warrant urgent medical evaluation. These complications are rare, but recognizing them quickly makes a significant difference in outcomes. Number 1, never expect the medication to work alone. This might be the most important point. Weight regain after stopping GLP-1 medications is documented across multiple trials. The Step 10 trial showed over 40% of lost weight was regained within just 28 weeks of stopping semaglutide. Zepbound 4 found more than 50% of weight loss with tirzepatide rebounded over 52 weeks. A systematic review published in January 2026 in the British Medical Journal found that people regain weight approximately 4 times faster after stopping GLP-1 medications than after stopping behavioral weight loss programs. Projected timeline to full weight regain, approximately 18 months. This isn't meant to discourage anyone, it's meant to set realistic expectations. Obesity is increasingly recognized as a chronic condition requiring ongoing management. The medication is a powerful tool, but it's still just a tool. The people who maintain results long-term establish exercise routines and dietary habits while on the medication, not after stopping. They prioritize sleep 7 to 9 hours nightly because hormonal disruption from poor sleep blunts medication effectiveness. They manage stress since chronic stress increases cortisol, which impairs natural GLP-1 release. Think of Ozempic like power steering. Driving is easier, but someone still has to steer the car. Quick recap of what matters most. The clinical evidence points to a clear pattern. Patients who treat GLP-1 medications as one component of a comprehensive approach, adequate protein, consistent resistance training, proper hydration, correct injection technique, attention to sleep and stress, achieve substantially better outcomes than those relying on medication alone. Here's the question worth considering. Which of these 11 mistakes surprised you the most? Drop a comment below. For more videos like this one, click here and learn more factual info on weight loss medications. And if evidence-based weight loss medication education sounds valuable, hit subscribe. More content like this is coming. See you in the next video. Stay cool and limitless.